Hi, Ms. Dayna.
Hi.
I'm Hima Dalal, Integrative Occupational Therapist, and Ms. Dayna went through a big surgery with the pelvic floor reconstruction, and she's going to share her experience that why therapy is needed and how it helped.
I had gender affirmative surgery for genital reconstructive surgery, but the procedure I had was also an innovative procedure called the peritoneal pull-through, where she actually took skin grafts from the inside of my abdominal cavity to make the neovagina. And so, and I've also found that the idea of having physical and occupational therapy afterwards had not been considered until just recently.
Mm-hmm.
And so, with the help of my case manager, who was able to get this approved and coming to me, and I know that it has helped my recovery come faster, because my physician's assistant, she told me that I'm progressing well for where I'm at to be 6 months out from my surgery. And the idea that people need to, especially if their insurance will do it, or if they can afford it, to get rehabilitative therapy after they've had their gender affirmative surgeries.
Now, this is a rare surgery, right, Ms. Dayna? And there are very few doctors in the whole world who are doing this type of surgery.
Yeah, the Dr. Whitberg in San Francisco is only one of 3 surgeons in the United States doing it, and there's probably at most a dozen worldwide doing her particular procedure. But her hope is, because it's not as invasive as one procedure, but it gives a better outcome than the other traditional procedure, so it's kind of a best of both worlds. And so within probably the next decade, this will probably be the preferred procedure.
And fortunately, we had a pre-op visit too, since you were getting your shoulder rehab, and we knew exactly what procedures he was doing. We had a plan post-op how to help, and talking to your plastic surgeon or the surgeon.
And also
she's an OBGYN surgeon, right?
Well, she's actually, her specialty is unique. It's a specialty. It's not even here. She is, it is a gyno combo specialty, which is brand new. She was one of the first to get certified in that specialty.
And the message to the people would be that internal muscles rehab as well as external muscle rehab, and then the healing of the abdominal graft all together, we had to work on that. So we did Crystal Myofascial Release therapy, we used the yoga techniques of inner muscle exercises, we did some breathing exercises, and then we did traditional pelvic floor exercises, and we're progressing you from static to dynamic exercises to build the strength for inside and outside muscles.
Well, and also one thing my physician assistant told me, and I think that coming to therapy has helped, is that as far as the depth preservation that I have had, because some people lose anywhere from 50 to 75% of the initial depth, and I've only lost about 10%.
So the scarring of inside has been prevented and preserved because we have been doing correct form of this
so my depth,
therapy.
I've only initially had 15 centimeters, and I'm at 14 now.
And psychologically, how helpful it was coming to integrative therapy?
Yeah, and I think that helped, because just the idea that I wasn't on my own on this recovery, because so many people after they had surgery are left pretty much to their own devices.
Right.
And as far as recovery, and I think that is something that there needs to be a recovery plan developed.
Well, I am very thankful that you came here. I'm thankful to all your surgeons that they gave us a chance to help you rehab, and you're on the almost progress to the dynamic exercises now, and pain is almost not there. So very happy to know that this is possible, that with you have a pelvic floor surgery, the therapy can be very, very helpful.
Yes, and I definitely, and I only found there's only been one research to indicate that it is beneficial. But I think that there is, even with my own experience, I definitely agree it's beneficial.
Yeah, thank you so much.
Thank you, Miss Hima.